The medical information included in this podcast is provided as an educational resource only. Please consult your healthcare provider before making any healthcare decisions.
This is a very important question regarding awareness, because these are rare diseases, and all LSDs are rare diseases. So I think that by doing continued training of residents, even physicians who do not see that many patients in their clinic, webinars, a podcast like this one, and really try to explain to them the importance of looking at small clinical manifestations, because you see, to detect from the beginning of symptoms to the full diagnostic of the patient, it might take 14 years for a man and 16 years for a woman. So they go from doctor to doctor without knowing that they have the disease. I've noticed by doing conferences that they become aware of that, and this is so useful throughout their clinic, throughout their life.
Lyso-GB3. Now, you may be wondering, what exactly is Lyso-GB3 and why is it so important? We have a passionate biochemist known for her groundbreaking work on biomarkers, particularly Lyso-GB3. And today we get to hear straight from her how biomarkers play a pivotal role in the diagnosis and monitoring of Fabry disease. Christiane Oribelle is the biochemist in charge of the Quebec Neonatal Urine Screening Program for hereditary metabolic diseases in Sherbrooke, Quebec. For those of you who have had the privilege of speaking or working with Christiane Oribelle, you know she comes with a deep commitment to advancing patient care, and her passion comes through in every conversation. Today, she is going to share her knowledge with us and help us understand why this biomarker is so important. So welcome, Christiane.
It's a pleasure to be here, Julia. Thank you so much.
Thank you. I'm excited to learn from you today. This is a complex topic, so I think most people have heard of GB3 and Lyso-GB3, but I think there remains some confusion distinguishing what the difference is. So maybe let's start with, what is GB3?
So GB3 is a biomarker for Fabry disease, but let's say, what is a biomarker? So a biomarker is an indicator reflecting the presence and or extent of biological activities that are in the body of patients, and they are directly related to the clinical manifestations and outcome of diseases. So that's a good biomarker. GB3 is comprised of 3 sugars, 2-galactose, a glucose, a sphingosine moiety, and a fatty acid chain. Whereas Lyso-GB3 is a similar molecule, but it doesn't have the fatty acid chain. So it is different from GB3. And we call that a deacylated molecule. Lyso-GB3 was detected by my colleague, biochemist in the Netherlands, Hans Ertz, a few years ago. And that was a very nice story. I remember asking him, he had shown a chromatogram with a big peak of Lyso-GB3 in plasma, and there was a little peak before that. And I asked him what it was, and he said, well, we did not do mass spectrometry at that time. So I thought, well, we should do a study to try to find other biomarkers for Fabry disease. So we did a study regarding Lyso-GB3 in Fabry patients who were not treated and controls. And we detected novel biomarkers for Fabry disease, which we call them analogs of Lyso-GB3. So they are different molecules. They're not the same as Lyso-GB3, but they are present in the plasma and urine samples of patients. So that was a very nice discovery for patients. And we can maybe talk a little bit more about that later on.
Absolutely. Okay, so now that we understand what both GB3 and lyso-GB3 are, let's talk about the incredible work that you've been doing. And can you explain how lyso-GB3 can be measured then?
Yes, well, in my lab, we have different mass spectrometers. So these are fine technology instruments where we can detect very low levels of biomarkers, either GB3 or lyso-GB3 and the analogs, and we can detect very high levels also. So it's high specificity, sensitivity, so we can detect precisely those biomarkers. So we see a spectrum, we integrate the peaks, and we can quantify them very easily. So these are really fine technologies, very useful for biomarker quantification.
Amazing. And that's done by both blood and urine, is that right?
Yes, exactly. We can analyze different matrices in different research studies. We can look at CSF. We can look at um, filter paper eluted samples. Depending, as long as the molecules are ionized, we can do mass spectrometry. Tissues, we can look at mouse tissues also.
Amazing. And I remember when you were speaking at the conference in Montreal, you spoke about actually collecting the urine from like a baby's diaper, and you were able to test that way as well.
Sorry, I'm sorry, I did not.
No, that's okay. I remember when we were in Montreal and you were giving a talk, and you were able to, you said you were able to measure from a baby's diaper, the urine from a baby's diaper. You're able to even measure that way.
Yes, yes. In fact, I'm a little bit biased regarding the screening using urine filter paper sample because of the urine screening program. We've screened like more than 3,700,000 babies with a urine sample collected on filter paper. So we have developed a few methods for lysosomal storage disorders using a urine filter paper sample, which is quite efficient because you can send a filter paper by regular mail, so you don't have the problem of having liquid urine specimen frozen and a special courier. And in fact, with the urine screening program, we've detected many patients using where parents can collect the urine sample at home. So for us and my team, it's really not a filter paper. It's a baby behind that. So when we analyze GB3 for the Canadian Fabry Disease Initiative on a filter paper, it's the same. It's a Fabry patient. So this is so important that we can use a user-friendly, I would say, method to analyze GB3 and report the results in a, I would say, easy way for the physicians.
I like the way that you say that, and I think it shows that there's the compassion behind everything that you do.
Yeah, well, I've been doing preventive genetic medicine for decades now. It's part of, everything I've studied is really to look at biomarkers and detect novel biomarkers, develop method, validate those methods, and transfer that to clinics. So if we can help the patients in the best way we can, it's really different links of a chain, and everybody is working to help patients in the best way possible.
Absolutely.
In fact, we want to make a positive difference in the lives of patients and their families.
Absolutely. You have such a way with words, and you're so passionate even when you're talking about mass spectrometry, which is just such a which is just so over a lot of people's heads. You're very good at this and breaking down this complex subject. So if you don't have a baseline lyso-GB3 level, is it important to ask your Fabry physician to have that measured?
Yes, I think that's quite important because if you start a treatment, let's say,
Okay.
you need to know what are the levels at baseline and to see what is the efficacy of treatment by looking at these biomarkers over time. So if you don't have a baseline level, it might be difficult to know what was the level before treatment. So that's quite important. And it should always be done before starting treatment.
Okay, so if you don't have a baseline lyso-GB3 level, consider discussing this with your healthcare team. Um, Christiane, can you tell us a little more about what information could be learned from knowing and monitoring your lyso-Gb3 levels so the patients listening can really grasp why that's so important?
Well, I think it's important when you want to monitor patients. Let's say a patient switches from enzyme replacement therapy to another therapy, let's say chaperone therapy.
Okay.
It's important to know what are the variations because of the switch to a different therapy. Monitoring lyso-Gb3, well, Albina Nowak, a colleague of mine, has mentioned the importance of looking at lyso-Gb3 because it can show, as to a certain extent, what's happening for clinical manifestations. She has published on that. Also, if you have anti-drugs levels in some of the patients, well, it's important to see what is the effect of treatment regarding those antibodies. So by measuring lyso-Gb3, you have a profile, and often you can measure GB3 also. You have a profile of what's happening in the patient. So monitoring is quite important, and to be able to do that by mass spectrometry and have low levels, like I mentioned, or high levels, you can follow up the patient over time. So that's very important.
Very important. And so then would you say that lyso-Gb3 is related to Fabry phenotype?
Yeah, well, that's interesting. There was a fine paper by Frank Wiedemann a few years ago looking at the different phenotypes in Fabry disease. And he had mentioned that he saw 3 different phenotypes. So the classical one, patients often have very high levels of biomarkers. And these were associated with the organs involved. So the classical phenotype usually involve the heart, the kidney, and the central nervous system. And then the second classification is less aggressive, I would say, phenotype, where there's only one organ involved, so either the kidney or the heart, let's say. And so these are late onset cardiac variant mutation. Often we see patients with lower levels of these biomarkers, but there's also a third phenotype, which is a different polymorphisms. Often patients do not have symptoms. They have very low levels of practically normal levels of these biomarkers. So depending on the organ involvement, if you look at lyso-Gb3, well, in the experience that I have, let's say with the Canadian Fabry Disease Initiative study, we can see that those who are having cardiac variant mutation really have low levels of these biomarkers. You can have exceptions also in these patients. Some might have another mutation, an intronic mutation that we do not know. But usually, the classical form of the disease, patients have very high levels of these biomarkers compared to the late onset form.
Okay, so just to make sure everyone is with us here, so lyso-Gb3 is a helpful biomarker for monitoring disease activity and treatment response, but it should be interpreted alongside clinical findings and other diagnostic information to get a full picture of each patient's phenotype. Is that right?
Yes, exactly. You're right, Julia. The biochemical aspect, it's important to look at a profile of biomarkers, but there's also all the biomarkers regarding the organ specific biomarkers. Let's say for the heart, if you're doing an MRI or echocardiogram, if you're looking at the glomerular filtration rate for the kidney or the creatinine or albuminuria, for a patient, it's really having a full profile of disease-specific, organ-specific biomarkers, but also biochemical markers such as GB3 and lyso-Gb3. Then you have a full profile and with the clinical manifestations, evidently, of the patient.
Okay, thank you. So it's important to bring awareness of Fabry disease for residents, GPs, physicians, and to detect Fabry, to detect patients early. So what are the means to do that?
And this is a very important question regarding awareness because these are rare diseases. And all LSDs are rare diseases, but if a patient goes through a doctor's clinic and the doctor is not aware of all the little intricacies, symptoms of the disease, and cannot detect a patient, well, this is so sad. So this is very important that they know about the different clinical manifestations, the treatment that are available. So when they see a patient, they can focus and say, oh, this might be a Fabry patient. We should push a bit further the investigation. So I think that by doing continued training of residents, even physicians who do not see that many patients in their clinic, webinars, a podcast like this one, and really try to explain to them the importance of looking at small clinical manifestations, because you see, to detect from the beginning of symptoms to the full diagnostic of the patient, it might take 14 years for a man and 16 years for a woman. So they go from doctor to doctor without knowing that they have the disease. So I've noticed by doing conferences that they become aware of that. And this is so useful throughout their clinic, throughout their lives, in fact. So this is very important for physicians to be aware of Fabry disease, clinical manifestations, and the treatments available.
I agree. And the earlier that someone knows in their life, the better outcome that they're going to have.
Exactly.
Have you ever done any screening programs? And if so, what are the results of that?
Yes, we've done a few studies, screening studies, high-risk screening. One was done with an optometrist in Montreal, Langis Michaud, a few years ago. So when he saw a patient who had corneal abnormalities, so either cornea verticillata or corneal opacity, he referred the patient to his physician, and we analyzed GB3 in a filter paper sample, as we mentioned previously. And if GB3 was abnormal, then at that time, the investigation was pushed a little further, and the enzyme activity was done, and the molecular testing was done. So with this high-risk screening, we detected 2 patients with Fabry disease and 5 patients in the family. So that was quite useful to be able to detect these patients by high-risk screening. We did another high-risk screening study in chronic kidney disease clinics. So this was done in 4 centers in Canada. So there was Vancouver, Ottawa, Quebec City, and us in Sherbrooke. And unfortunately, we did not detect any Fabry patients through these chronic kidney disease clinics, but we did find that GB3 might be increased even if it was not Fabry disease. So GB3 is not, I would say, totally specific for Fabry patient. It can be increased in patients having kidney problems, but also it can be increased in patients having cardiac problems. That was published by Rafi Schiffman a few years ago. So it's less specific, I would say, than lyso-GB3.
Okay. And now, are there any new biomarkers or any new research that you're working on that you'd like to share with us?
Well, we're always working to try to improve the lives of patients. So I don't know if you remember, there was a gene therapy trial, clinical trial in Canada.
Yes.
We were the first worldwide trial on Fabry disease. So we were the one who analyzed biomarkers. So we analyzed biomarkers in 5 patients, 5 men having classical mutation over a 5-year period. This was published in Nature Communication. And we've just had a paper where we analyzed all the biomarkers over time. So as you can see, the biochemical markers are very important to see what's happening for the patient. And then if you add on the organ involvement specific markers, then you have a pathophysiology aspect of the patient, which is quite important. We did also another study, which was quite interesting, in patients switching from enzyme replacement therapy to chaperone therapy, to migalastat. When we did that study, what was interesting is that we did it for 1 year.
Okay.
So we had 4 time points, remember baseline, and 3 other time points. And we've looked at what was the effect of switching from one therapy to the other. And in the end, for this short period of 1 year, we did not see any marked differences between the patient before switching and after switching to the chaperone therapy. So again, quite interesting to evaluate biomarkers over time as longitudinal studies, either for gene therapy or this chaperone research study.
Your research, I just want to say this on behalf of all patients and all Fabry patients, that your research is really making a real difference in the lives of patients living with Fabry. So thank you. And if you could leave patients with just one message, what would you say to them?
I think that patients should meticulously follow their treatment, and when they are going to be to have a follow-up, be there. It's quite important to be compliant. And if they have changes in symptoms, in clinical manifestation, it's important to mention that to their physician in order to be able to adjust the treatment or see what's happening. So I would say this is quite important, and I hope I've been able to convince you of the importance of biochemical markers like GB3, lyso-GB3, and also to analyze a full profile with organ-specific biomarkers.
So be compliant and ask for a baseline lyso-GB3 level if you don't have it yet. And your commitment has just demonstrates so much care and compassion. So thank you for all that you're doing, and thank you for sharing your time with us today.
Well, it was a pleasure to be here with you and to share. You're doing such good work, Julia, with your team. So it's a pleasure to be able to explain a little bit more on biomarkers for Fabry disease.